Hey everybody, it's Dr. Choi here at North Texas Dental Surgery. Today I have a special guest, Dr. Lázaro, who's one of our prosthodontists here at this practice, and we are very blessed to have some prosthodontists here working with us because we know you guys are highly skilled in what you guys do. And I wanted to bring to the public's attention today, let's talk a little bit about veneers, full mouth rehabs, and a lot of the aesthetic work that people can get nowadays. And so I was recently on social media looking at TikTok, Instagram, and they were pointing out there's like a lot of veneer cases that are going wrong. And so I wanted to get a prosthodontist's opinion on this. Like, so in your opinion, why are there a lot of these veneer cases going wrong out there?
I think the main reason is that there's like a lot of dentists out there doing veneers that they shouldn't be doing them because they don't know what they're doing. I've been like resident at USC teaching students. Also, I'm a part-time faculty now at Texas A&M, and I can tell that students are not taught anything about veneers. So when they leave dental school, they don't know anything about veneers. So most of the dentists don't know what they're doing.
You said that, you're obviously a prosthodontist who did a prosthodontics residency. So are you saying in order to get the training on veneers, like that people should have to go to a prosthodontics residency?
I don't think you must go to a prosthodontic resident in order to do veneers. I assume that any prosthodontist should be good doing veneers, but you can be a general dentist. You can have like extra training, continuing education courses, or any other kind of fellowship or training in veneers, and you can be a very good general dentist doing veneers. But you need extra training after dental school in order to do veneers for sure.
Anybody can do veneers as long as they go out there and they pursue the education that's necessary for them to be able to be good at them.
Yeah, and also it depends. Every case of veneer is different, so depending on the amount of training that you have, you're gonna be able to do like up to some kind of complexity. You know what I mean? As a prosthodontist, we should be able to do any kind of case. So general dentists just like trained a little bit extra training on veneers, they might be able to do like many cases, but maybe not the most complex or most demanding.
Very similar to dental implants, right? So if you have great bone and great gums back in the posterior mandible, a dental implant's super easy, right? But the moment you have less bone or you're dealing with an anterior dental implant, you need to get some bone grafting, then results can be less predictable, right? So
Guess what? Most dentists recently graduated, they do veneers, but they don't place dental implants. However, they have less training in veneers than what they have in dental implants.
So tell the public a little bit more about what can go wrong with veneers.
The main issue with veneers is the amount of tooth that it's drilled or prepared. So what we see mostly is like dentists that they don't know what they're doing. They like drill the tooth too much for a veneer, and that's not a right preparation for a veneer because the number one rule of a veneer is like minimal invasive. It's a minimal invasive, highly conservative treatment. Also, other things that can go wrong if the veneer is not properly done. Normally, they're like over-contoured, they're like too bulky, too thick, and that creates gum problem. So you just maybe want like a veneer for aesthetics, and then you get very pretty teeth, but those destroy your gums. Your gums are inflamed, swollen, and if that doesn't get treated and gets chronic, you can have bone loss just for an aesthetic reason. Other thing that can go wrong with veneers is the bite. If you don't take into consideration the bite, which means like how the teeth come together, then the veneers are gonna fracture or they're gonna pop off. So you need to know that we know as prosthodontists that the bite is just not like static, like biting down like that. It's like a dynamic thing, which like you have to consider like patient like during the whole function during the day. And if you don't consider the whole bite of the patient in a dynamic way, the veneers are gonna break or pop off.
So can you delve a little bit more into that? So I hear that I obviously don't do veneers, but from all the patients I've seen over my 14 years of practice, I have heard a lot of complaints about patients saying that their veneers popped off while they're on vacation or like basically at the most inopportune moment. What exactly is going on there? Why is that happening?
I mean, the reason why it happens in vacation is Murphy's Law. You know what I mean? Like it happens at the worst moment. But why it happens mainly is three main reasons. One, the bite, if the bite is not adjusted properly. Second, the bonding protocol, which means like the way you bond the veneer to the tooth, that's very important. It's a very like step-by-step process. If you miss one step, then it's not gonna work. Or the third reason might be how much they drill the tooth. If your dentist drills your tooth too much, then you get into dentin, which is the inner layer of the tooth. And we know that dentin and veneers on dentin, they're gonna last less than veneers on enamel, which is the outer layer. So if they drill a lot the tooth, your veneer is gonna fail earlier.
So can you explain to me why if you did shave down a tooth a little bit more and then the veneer is trying to bond to dentin, why would that not bond properly? Could you explain that?
I mean, without getting into too much detail, just the main reason is that bonding to enamel is predictable. Bonding to dentin is less predictable. Can it be done? Yeah, of course, we do it every day. But if you can bond to enamel, which is the outer layer, much better. It's gonna last longer, the veneer, like 5 to 10 years more.
Yeah, that's pretty
That's like the
significant.
gold standard, you know what I mean? If you only have dentin, you have to bond to dentin. But if the patient has enamel, just keep it on enamel, because that's one of the most important factors in terms of like how long the veneer is gonna last.
You're talking a little bit about enamel and dentin, and so can we take a step back and let's talk about what really is a veneer and how is that different from a crown? And why are we, if a patient is looking for something aesthetic, why are we talking about veneers being the best solution for that patient?
So a veneer is just like a layer of porcelain or composite, which is like bonded to the front part of the tooth. The difference between that and a crown is that a crown, for a crown you have to drill the tooth all around, all the surfaces, and the amount of drilling is much more. For a crown is 1.5 to 2 millimeters all around. For a veneer is around half a millimeter, 0.5 millimeters. So that makes the biggest difference. And why is that important? Is because the more tooth structure you keep, so the less you drill your tooth, the more years that tooth is going to last in your mouth. And when failure happens, normally when a crown fails, it's because the tooth breaks, most of the cases. Or there's like cavities. Something happens on a veneer, either the veneer breaks or the veneer debonds. Patients don't like that, but the good thing about that is that your tooth is still intact. So what do you win? What do you want? Your tooth to fail or your restoration to fail? I chose my restoration to fail because you can replace it. But if your tooth fails, there's nothing you can do. So that's the main difference.
So what you're saying is that if you have a more conservative preparation when you shave down your tooth from the beginning, because you only kept it half a millimeter thick and you kept it only towards the outer edge of the tooth, that God forbid one day, because every time you mess with the tooth, you have a timer, you're putting a timer on it, right? And so like you're saying that one day when you do need to work on that tooth again, you have more viable tooth structure to work with. Unfortunately, with crowns, a lot of times that patients don't understand is that once you start shaving down a tooth, like for a crown, you have to shave down way more of that tooth. And then when that tooth goes bad one day, because like as you said, like a common thing that's going to happen is like either the tooth breaks off or there's going to be more decay underneath there. Then we're getting, maybe we can't even do another crown, or even if we can, then now you have to get a root canal involved, more money, more invasiveness, potentially root canals could get infected too. So there's just, as you said, Murphy's Law, there's just more things that could potentially go wrong. But here's the sad thing that I noticed in a lot of these videos and photos that I've been seeing. Patients are interested in getting veneers. They don't really have a fundamental understanding of what veneers really are. And they go to a clinic and they get veneers, but then when we're actually seeing like selfies and videos of what their teeth actually look like, their teeth are shaved down significantly. And we as dentists can tell that those are actually crown preparations, right? So could you explain to us like why this is so damaging to the patient? Well,
Yeah, the main reason why that is so bad for the patient is because the more they drill your tooth, the less that tooth is going to last. You start what we call into the restorative cycle. So the more you drill the tooth, the earlier it's going to fail. The more drilling on your tooth, the more risk of like having like tooth sensitivity, or in worst case scenario, need a root canal treatment. And if you need a root canal treatment, that's a completely different scenario. Sometimes it works really good, sometimes it works worse. And tooth that are root canal treated, they last less years. And then the second question is like, who's going to do the root canal? Because it's not the same if the root canal is done by an endodontist or by a general dentist. So by all means, we try to avoid like getting to the pulp of the tooth in order to avoid root canal.
another question that a lot of patients ask about are porcelain versus composite veneers. Can you tell us about the differences other than the cost? Because based off of my research, it just seems that composite veneers are cheaper.
Yeah, the main difference is that porcelain veneers are done in the lab, while composite veneers are done chairside. That involves that the result with porcelain veneers is better, the aesthetic result in terms of like the aesthetics is better. They don't stain, they don't wear, and they don't need maintenance. However, composite veneers, they're like cheaper, but they stain. If you drink like coffee or wine, they're gonna stain a lot. They wear, And also they're gonna lose its shiny. They're not gonna be shiny. You know what I mean? And they're gonna need maintenance. Plus the end result, in my opinion, it's better the static result with porcelain veneers just because they're done like lap side, not chair side, which means that you have more time, more attention to detail. Where chair side, you have like the time the patient is on the chair and that's it. And it's also very dependent on the provider, on the dentist, depending on the hand of the dentist. That's totally chair side veneers, composite veneers. They depend on how good your dentist is, how good their hands.
What do you mean by how good their hands are?
So dentistry is an art, you know. So and there's dentists that whose hands are like really, really, really good, like they're like artists, like they're touched by God. And there's dentists whose hands are like really, really, really bad. Most of the dentists were average, like that's a bell shaped curve. But you can also find like very bad dentists with very bad hand skills and dentists with very good hand skills. So composite veneers, they mainly depend on the dentists who are doing them.
So you're telling me that people shouldn't do composite veneers at all?
I think composite veneers might have some indications, like for example, in like young patients, you know, which you don't want to do like porcelain veneers yet. You want to wait a few years. Or if it's not a whole veneer, just like partial veneer or just like some kind of like small bonding on some areas, yeah, I would rather do composite than porcelain. But if you're gonna do like a whole veneer or like a bunch of like 10 to 12 veneers, I would go with porcelain for sure because the result is gonna be better. It's just more expensive.
So let's talk about another detail that a lot of patients don't know about. Let's talk about opaque versus translucent veneers. What is the difference and why should patients know about this difference?
Yeah, so translucent veneers give you a more natural result in which it looks more like your natural tooth, while opaque veneers is more like a Hollywood smile, like very wide, shiny result. So it's important for the patients to know what they want, because those patients that want like very natural teeth, like for example, European patients, they want natural teeth. But I've seen our like American patients, especially in California, they want like very wide, opaque teeth. So it's important to know that beforehand in order to know how much you have to prepare that tooth and which material to choose.
So let's talk about pop-on veneers because that's another thing that people frequently ask about. And we recently had a patient who came in for an all-on-4 consult because she unfortunately was losing all her teeth because she'd been wearing this pop-on veneer that she bought from Amazon several years ago. So could you tell me a little bit more about what pop-on veneers are and why they may be an issue?
Pop-on veneers, they're not even veneers. It's just like a piece of plastic that you buy on Amazon and you put around your tooth, all over your teeth. They try to mimic like the shape of veneers, but of teeth, but they're not. They're not actual teeth. They're not veneers. Just a piece of plastic. Um, but that's a problem for the patient because that's gonna make your teeth look like really bulky, and that's gonna hold like a lot of like plaque, bacteria, food, and that's just gonna damage more your teeth. That's gonna create cavities. That's gonna create like gum issues and also a bite problem because your bite is gonna be awful, and that can the consequence can be also like a joint problem. So pop-on veneers are only problems. Nothing good. They should be legal or banned.
So can you tell me a little bit more about the role of the gums whenever you're considering veneers or any sort of aesthetic results? Because I've seen some images of some patients where they had some veneers and I could see how puffy their gums are and just the amount of inflammation that must be happening underneath those veneers. So what role do the gums have when you're considering veneers?
Yeah, that's like the patient I saw this morning. I just removed like I think like 20 veneers or I don't know how many composite veneers that they were like so thick, so over contoured that they were like impinging towards the patient's gums. So the patient couldn't clean. So her gums were like so swollen, so inflamed. She had a bad breath. The gums were swollen. The patient was in so much pain. So if the veneers are not done like properly, like respecting the contours of the tooth, that's gonna create gum inflammation, bleeding, pain, and can even create bone loss in the long term.
Right. And we know that once that patient has bone loss and then also the gum loss between the tooth, then that puts you in a very compromising position, right?
I mean, for example, this patient today, she asked me like, how, are my gums gonna come back to normal? I'm like, I don't know. Now we have to wait until the gums heal, and when the gums heal, like that's biology. We'll see, because they're irritated. Maybe now the gums heal and they just like whoop, move up. And that's a consequence of poorly done veneers.
Let's talk about a topic that a lot of patients have questions about is obviously the cost associated with veneers. So what would you tell the public in regards to what influences the cost the most in regards to veneers?
So obviously there's a bunch of factors. It depends on where you are. It's not the same if you're like in Dallas or if you're like in Michigan or you're in New York or Beverly Hills. You know, it's a completely different story. And the second very important factor is the dental technician, the laboratory you're working with. There's laboratories, the cheapest one is in China or Turkey or Mexico. They might charge like $40 per veneer. And there's very expensive labs in California or in Italy, let's say, that they might charge you up to $1,000 per veneer. So depending on which lab you're using, the cost of your veneer is going to be higher because you have to charge that to the patient.
So what is going on at that lab that they're charging so much?
It's just the dental technician has a lot of experience. His hand skills are really good. He's like an artist, and he takes normally it's like a manual process. You know what I mean? Like, and they take a lot of time to do it. You know, they said like maybe 1 or 2 cases a day. If you work in a cheap lab, it's just like a factory. You know what I mean? It's like one after the other, one after the other, one after the other. There's no quality control. They just want the money. So that's the main difference.
So you're saying that basically the artisanship of the dental technician is almost as important as the dentist when they're doing veneers.
Oh, yeah. For veneers, I would say it's like 50-50, at least. Even maybe more important the dental technician than the dentist. But guess what? Normally, a dentist that knows what he's doing, he wants to work with a good technician, because you know that even if my work is perfect, my lab technician is not good, my work is going to be terrible. The end result, you know what I mean? So normally, someone who knows what they're doing, they work with good lab technicians, because that's the only way of getting a good result. So that's why I would say like 50-50.
So Dr. Lazaro, what would your final take-home message be in regards to if you had any recommendations for patients about what their final take-home message from this conversation, or what you know about veneers?
So unfortunately, I would say that the most important thing is to find an honest dentist, someone that indicates veneers only if you need them, because what I see out there is that most patients who get veneers, they don't need them, and that's just the dentist indicating veneers in a patient that doesn't need them. For example, the other day we saw this patient in which he came for veneers, and I'm like, I'm sorry, you just need braces, that's it. So I think that's very important. And the second very important part is to make sure you're choosing a dentist who has the experience and the training needed to do veneers. Just, if you don't have the training in veneers, you don't know what you're doing. And obviously, the more experience you have, the better, because it's a balance. You have to have a little bit of everything. So have a dentist who's an honest dentist, tells you the truth, doesn't want to sell veneers if you don't need them. Make sure that he's trained in veneers and he has experience doing veneers.
All right, thanks, Doc. That was great information. If you guys have any questions out there, please feel free to leave them in the comments below, and we'll do our best to try to answer them on our next videos. Thanks.
Thank you.